Hi everyone, welcome back to my channel. In this video, I'm going to simplify lesion excision coding step by step. So watch the video till the end and don't forget to subscribe if you're new to my channel. Let's get started. First, we'll see the definition of a lesion. A lesion is an abnormal area in tissue or an organ caused by injury or disease such as wound, ulcer, abscess, or tumor. Next, we'll see the definition of excision. So, what is excision? According to CPT guidelines, excision is defined as full thickness removal of a lesion through the dermis, including margins. Next is about CPT code selection. So to pick the appropriate CPT code, first we need to verify the type of lesion, next anatomical location, and then size of the lesion. So first we need to identify the type of the lesion, whether it is benign or malignant. Benign lesions are non-cancerous lesions and the malignant lesions are cancerous lesions. So if you see the terms neoplasm, cicatricial, fibrous, inflammatory lesions, congenital lesions, or cystic lesions, these are all the examples of benign lesions. Next, examples of malignant lesions: basal cell carcinoma, squamous cell carcinoma, melanoma. These are the examples of malignant lesions. As we discussed earlier, the codes are categorized based on the anatomic locations. So for trunk, arms, and legs, we have a set of codes, and for scalp, neck, hands, and feet, different set of codes, and face, ears, eyelids, nose, and lips, we have different sets. So each location has different CPT subranges. Next, we need the size of the lesion. So size is calculated by measuring the excision diameter. This is where most coders make mistakes. According to CPT guidelines, excision diameter is equal to greatest clinical diameter of the lesion plus narrowest margin into 2. Let me repeat that. Excised diameter is equal to lesion size plus margins taken on both sides. Okay. Example: if the lesion measures 1.5 centimeter and the narrowest margin taken is 1 centimeter means, then the calculation will be based on the formula, that is lesion size plus narrowest margin into 2. So the lesion size is 1.5 centimeter here plus narrowest margin is 1 centimeter. So 1 into 2, 2. So 1.5 centimeter plus 2 centimeter is equal to 3.5 centimeter. That is our excised diameter. So you will code based on 3.5 centimeter, not 1.5 centimeter. Okay. I hope you're clear now. Next, CPT code ranges. So for benign lesion excision, we have a code ranges from 114002 to 11446, and for malignant lesion excision, CPT code ranges from 11600 to 11646. So the code selection will be based on the type of the lesion, anatomic location, and the excision diameter. Next, excision coding guidelines. First, we'll see the closure guidelines. This is very important for interviews. So if the excision is performed along with simple repair, we should not code the simple repair separately, since simple closure is included in excision itself. If intermediate or complex repair is performed, then we can code it separately along with excision procedure codes. If the excision is performed with adjacent tissue transfer, we should not code excision separately. We have to code only the adjacent tissue transfer. The CPT code for adjacent tissue transfer ranges from 14000 to 14302. Next, we'll see CPC exam practice questions. First, a 1.2 centimeter benign lesion is removed with 0.4 centimeter margin. What is the excised diameter? So the answer is option B, 2 centimeter. Here the lesion size is 1.2 centimeter and the margin is 0.4. So 1.2 plus 0.4 into 2, 0.8. So 1.2 plus 0.8, 2 centimeter. Next, simple closure performed after benign excision. Should closure be coded separately? Correct answer is option B, no, since simple closure is bundled into excision. Okay, so that's all about today's video. If this video helped you understand lesion excision coding clearly, subscribe to my channel, and if you have any doubts, please mention it in the comment section. I'll review and reply to your queries. Thank you for watching. Bye bye.